Hello, gentlemen. If you are over 50, 60, or well beyond, and you have recently noticed a quiet but unsettling change in your intimate life, I want you to listen carefully and calmly. You may still feel the familiar buildup of pleasure, you may still reach climax, but when that moment passes, there is little or no seminal fluid present. Maybe it happened once and caught you off guard. Maybe it has happened more than once, and you have been thinking about it late at night, wondering what it means and whether something inside you is failing. Many men carry this concern silently. They feel embarrassment, they feel fear, and they often assume they are alone. You are not alone. My name is Dr. Sophia Jane. I am a urologist with more than a decade of experience working closely with men at every stage of life, especially later adulthood. Today, I want to speak to you in a direct, respectful, and reassuring way. First, hear this clearly. What you are experiencing is not a verdict on your masculinity. It is not a sign that your intimate life is over, and it is not something you should feel ashamed of. This change is information. Your body is communicating with you, and once that message is understood, the fear often disappears. Stay with me, because what we are about to discuss can restore not only clarity, but confidence, peace of mind, and a sense of control over your health. Before we talk about what happens when fluid is absent, it helps to briefly understand how things normally work. Not in a textbook way, but in a practical, human way. Think of your reproductive system as a well-rehearsed orchestra. Each section has a role, and timing matters. The testicles produce sperm, the seminal vesicles provide most of the nourishing fluid, the prostate adds protective components that support sperm function. All of this comes together in the urethra, like instruments lining up before a performance. When climax occurs, a precise sequence of muscle contractions moves that fluid outward. It happens quickly, it happens automatically, and for most of your life, you never had to think about it. Now, here's something many men do not realize until later in life. Climax and ejaculation are not the same thing. Climax is a neurological event. It happens in the brain and nervous system. It is the sensation of pleasure, release, and satisfaction. Ejaculation is mechanical. It is the physical movement of fluid through a series of structures. Most of the time, these two events occur together so seamlessly that they feel inseparable, but they are driven by different systems. What we are discussing today is known medically as dry ejaculation. This is when a man reaches climax, experiences pleasure, but notices little or no fluid afterward. Many men describe it as confusing, others describe it as unsettling, some describe it as frightening, and I understand why. For decades, fluid was the visible confirmation that everything was working as expected. But here's the important truth. Your ability to feel pleasure can remain fully intact even when the mechanical process changes. It does not mean you have lost your vitality. It means a specific part of the system is behaving differently, and there is almost always a clear explanation. Take a slow breath here. If this conversation already feels helpful, take a moment to support the channel. A simple like lets this message reach men who may be struggling in silence. Subscribing ensures you receive future guidance focused on aging with strength and clarity. And if you feel comfortable, leave a comment sharing where you are watching from. This community exists so men can learn without shame and without judgment. Now, let us talk about the most common reasons this happens. Understanding the cause is the first step towards confidence. The most frequent cause is something called retrograde ejaculation. To understand this, picture a small, muscular valve at the opening of the bladder. Its job is simple but critical. During climax, it closes tightly, directing fluid outward instead of backward. When this valve does not close properly, fluid takes the path of least resistance. Instead of exiting the body, it flows backward into the bladder. You still feel the pleasure, you still reach climax, but there is little or no visible fluid. One practical clue many men notice is cloudy urine after intimacy. That cloudiness is harmless. It simply means the fluid has mixed with urine and will be expelled later. Why does this valve stop working properly? The most common reasons are medical, not personal. Certain prostate or bladder surgeries, even when highly successful, can affect the nerves controlling this small valve. Some medications used for high blood pressure or enlarged prostate conditions also relax smooth muscle tissue, including this small gatekeeper. I recall a patient who came to me deeply distressed after prostate surgery. He feared something fundamental had been taken from him. Once he understood that his desire, pleasure, and connection were untouched, and that this was a mechanical change rather than a loss of manhood, his entire posture changed. Relief replaced fear. The second major cause involves blockage rather than direction. In this case, the glands are doing their job. Fluid is being produced, but the ducts that carry it are partially or fully obstructed. Think of it like a pipe that has narrowed over time. Scarring from past infections, particularly untreated or severe prostatitis, can restrict flow. In rare cases, tiny calcifications can form and block passage. Men with this issue sometimes notice gradual changes rather than sudden ones. The volume slowly decreases, the fluid may become thicker, some men feel mild pelvic discomfort during climax. The encouraging news is that many of these blockages are treatable. Anti-inflammatory medications, targeted therapies, and minimally invasive procedures can often restore normal flow. The third major factor involves hormones, particularly testosterone. Testosterone is not just about desire, it fuels the entire reproductive system. When levels drop significantly, the prostate and seminal vesicles may produce less fluid. Over time, men may notice weaker erections, reduced desire, less intense climax, fatigue, and mood changes. This condition is known as hypogonadism. It is not simply getting old. It is a medical condition that can be identified through a blood test. When appropriate, carefully managed hormone therapy can improve not only fluid production, but energy, strength, mood, and overall quality of life. And this is where many men feel regret. They waited too long, assuming decline was inevitable. It is not.
While most cases are manageable and non-dangerous, there are moments when dry ejaculation should never be ignored. As a physician, it is my responsibility to be very clear with you about this. If the change appears suddenly and without explanation, pay attention. If it is accompanied by pain, burning, fever, blood in the urine or semen, numbness in the groin, or a sudden loss of sensation, do not wait and hope it resolves on its own. These signs require prompt medical evaluation. Certain neurological conditions, such as Parkinson's disease or multiple sclerosis, can interfere with the nerve signals involved in ejaculation. Long-standing, poorly controlled diabetes can damage the nerves and blood vessels responsible for this process. In rare cases, specific urological cancers can affect the pathways involved. These are not reasons to panic. They are reasons to act early. The earlier a cause is identified, the more options you have and the better the outcome tends to be. Now let us talk about something just as important as the physical explanation, the emotional impact. For many men, ejaculation is deeply tied to identity. It has been present through youth, adulthood, relationships, marriage, and fatherhood. When it suddenly changes or disappears, the mind fills the gap with fear. Thoughts like, "Something is wrong with me," or "I am no longer whole," quietly take hold. Some men begin avoiding intimacy. Others withdraw emotionally. Many never speak about it at all. This silence does more harm than the condition itself. Here's the truth you deserve to hear. Your value as a man is not measured by volume. Your ability to connect, to feel pleasure, to give and receive affection does not disappear because fluid does. Pleasure comes from the brain. Connection comes from presence. Intimacy comes from confidence and communication. When men finally understand that this change is physiological, not personal, something shifts. The tension eases, the shame loosens its grip, and solutions become possible. One of the most powerful steps you can take is simply talking. Talking to your doctor, talking to your partner. A partner who understands what is happening is far more likely to offer support than judgment. And most doctors, especially urologists, have these conversations every single day. There is nothing unusual or embarrassing about asking questions that protect your health. Let me give you a clear, practical plan moving forward. First, do not ignore the change. Whether it happened once or has been ongoing, bring it up at your next medical visit. A detailed history, a physical exam, and sometimes a urine or blood test are often enough to identify the cause. Second, manage the conditions that quietly affect this system. High blood pressure, diabetes, high cholesterol, and obesity all impact blood flow and nerve health. Controlling these does more than protect your heart. It protects your sexual health and overall vitality. Third, review your medications. Never stop a medication on your own, but ask whether adjustments are possible. Sometimes a small change makes a significant difference. Fourth, address hormones when appropriate. If testosterone levels are low and symptoms are present, treatment may improve far more than you expect. Energy, mood, confidence, and intimacy often improve together. Fifth, break the silence. Speak openly, without apology. There is strength in taking responsibility for your health. Many men tell me they wish they had come in sooner, not because the condition worsened, but because they spent unnecessary months or years carrying worry alone. I want to leave you with this perspective. Dry ejaculation is not a dead end. It is a signal. Sometimes it points to a mechanical change, sometimes to a blockage, sometimes to a hormonal shift. Occasionally, it highlights a condition that needs attention. In almost every case, clarity brings relief. I have seen men in their 60s and 70s regain confidence they thought was gone forever, not because everything returned to how it was at 20, but because they finally understood their bodies and worked with them instead of fearing them. Your vitality is not behind you, it evolves. And when you stay informed, proactive, and open, life after 60 can be deeply satisfying, connected, and strong. If this message helped you understand something about your body, take a moment to support the channel. A like helps this reach men who may still be worried in silence. Subscribing keeps you connected to honest, calm guidance designed for later life. And sharing this with a friend, brother, or father could truly change how they see themselves. Remember, taking action is not weakness, it is wisdom. Stay informed, stay confident, and take care of your health with the respect it deserves.